Hey guys, Dr. Josh Jagoda here. Today we're going to get into that question that I get is what happens when I crack my own back, or what happens when I crack my own neck? What are some of the repercussions out there, and what does it really mean? So first things first, we have to understand what the crack is, and the crack or that pop or that click, whatever you want to call it, is the release of nitrogen gas within the joint. So that pop like that is just a release of gas. It's a sudden stretch also in the capsule, and then temporarily what we're going to have is an increase in the joint space. So over the next 20 minutes or so, it may get a little bit decreased, but within that, after that crack, you're going to have an increase in range of motion. So why should I tell my patients to crack or to not crack their own back, right? So the problem with cracking your own neck or back is that it may not be specific. So for example, I'm going to just take my neck right here. If this neck part right here is very, very tight, what I'm going to want to do is stretch it out, and I might try to pull or push it and get a release, a crack, a pop, a cavitation, like I said, whatever you want to call it. So that pop or click is, like I said, a release of gas. And then what happens is that increase in space. So every time we are looking to crack our own back or neck, it is very, what we call, non-specific. So you might be getting that area that is uncomfortable and tight from time to time, but more often than not, you are not being localized. You're not actually focusing on the pathology. You're not focusing on the problem. This might be the area that is tight, but the area that actually might be exhibiting dysfunction might be above, it might be below down to here, creating that tightness, and this muscle right here might be tightening up. So what you might be doing is actually cracking or popping an area over and over and over that doesn't need to. So what happens when you crack an area over and over that doesn't need to be adjusted or popped or clicked, right? So what happens from that point in time, that area will start to exhibit what we call a hypermobility. It's going to have, quote, too much movement, right? So at first you might be trying to like really force it, and then eventually you'll stretch your head like this and it'll pop on its own, and then eventually you'll just go crack, crack, and then eventually it will become more and more unstable. So just like stretching, the more you do it, right, the more movement or mobility you'll get out of this. So same thing with my neck. If I keep popping my neck over and over and self-releasing my own back and neck, it's going to get easier and easier to do. You're going to be creating an unstable or a hypermobility area. So the problem with hypermobility is that when you get too much movement here, the area above and below is going to have to compensate. So when you get too much movement here, this area is going to get super tight, this area is going to get super tight below it, and then guess what happens, guys? You're going to end up feeling like you need to crack this area more and more and more. So this instability or this hypermobility is a risk factor for disc bulges, disc herniations, ligamentous tears or ruptures, things like that. So if we do not have a stable spine, we want some mobility, but we also want stability. And if you constantly crack and pop and pop and pop and pop over and over and over for weeks, months, or years, and I'm talking about like chronically, like 4 or 5 times a day, trying to get that release all the time, that is when you're going to run into future problems with instability, and it can cause, especially in the neck, it can cause headaches, things like that. It can cause continued tightness within the neck or even anywhere in the back. So this can really cause more problems in the future. It can accelerate arthritic changes because there's too much movement, and so what the bone will start doing through what we call Wolff's Law is laying down more bone to help stabilize that. So guys, the reason chiropractors and other manual therapists are out there is to be pinpoint and specific with their adjustments. If this is the area of problem, then self-mobilizing shouldn't be an issue. It should go away over time. If you're chronically trying to crack your neck, there might be a deeper issue, and there might be something worth investigating. All right, guys? So if you are going to mobilize yourself, fine, have a good time. Don't force it. Make sure if you are forcing it and if you find that over and over it's the same area, look deeper, look for different muscles, try something new, try different mobilization, try different technique, see if that resolves it. If that doesn't resolve it soon after, then make sure you see some sort of trained therapist that knows what they're doing and can really assess that injury. So make sure, again guys, if you are cracking your own neck, popping your own back, whatever it may be, that there is some risk involved, but there is also some reward involved. Make sure that if at some point in time it's not getting better, that you really seek out a different alternative to make sure that you can fix this. Alright guys, I'm Dr. Josh Jagoda. Thanks for stopping by. We'll see you guys for the next episode. Take care.